Hi all, welcome to Easy Nurse, where nursing education made easy. Yes, so last live classes we have discussed till unit number 7. So today community health nursing from third year GNM we are going to discuss about unit number 8, unit number 9 and unit number 10. So this will be the last live classes because we are completing all the chapters. So first we will discuss about unit number 8, that is health team. So what do you mean by health team? Yeah, it's nothing but the medical professionals or the professionals they are studied medicine or they are working in the medical field. That is what called a health team. So they will give the best patient care to the patient. So they are including doctors, nurses, lab technicians, other departments. So let's see what is health team. So health team typically consists of various healthcare professionals. So it's a team that consisting of various healthcare professionals who work together to provide comprehensive patient care. So why they are working? They'll work together to give the best possible care to a patient. So that is what called health team. So it's consisting of various healthcare professionals like doctors, nurses, technicians like lab technicians, X-ray departments or other radiology department, radiologists and also pharmacists, nutritionists. So many people are working in the field of healthcare professional. That is what called health team. So let's discuss about what are the members, who are the members coming in the health team. So first one is doctors. So what is the doctors? They will diagnose the illness. So from a patient, so if a patient come to the hospital, who will diagnose the illness of patient? That is doctors. So doctors will diagnose the illness, prescribe medication. So prescribe the treatment for that patient. So prescribe the medications, develop treatment plans for patient. So what treatment basically the patient is needed, that plan will be developed by a doctor or a physician. So they are different doctors. Specialist. So specialist doctors include like they will specialize in one category of medicine. So like in general medicine they are called physicians. Coming to the persons who is working as a cancer, treatment of cancer, then they are known as oncologist. So and the persons who is working in a cardiovascular disorders, they are known as cardiac surgeons, so like surgery, cardiac surgeons, and also the persons who is doctor working in the neuroscience and is known as neurosurgeon or the person who is a neurologist. So this is all the doctors. So by speciality they'll differ and their name also will change. So basically they'll diagnose the illnesses, they'll prescribe the medicines and also they will plan the treatment for a patient. So coming to the next category of people that working in the healthcare team, that is nurses. So we are nurses. So nurses that provide direct care. So registered nurses, they completed their diploma or degree in nursing. So they will be registered nurse, they'll provide direct patient care. So we are the people, we are giving the direct patient care to the patient. So direct patient care, administering medications prescribed by the doctor. So we'll see the chart of the patient and we'll administer the medications. Monitoring vital signs. So as a nurse, your basic responsibility is to monitor vital signs, educate patient and their families about health conditions and self-care. So as a nurse, you have also the plan. You have also the role of a health educator. So you are also a person who is educating. So health educator also you have a role. So this is nurses and their roles. So next we will see about the next team, that is pharmacist. So example is pharmacist. Who is pharmacist? The person dispensing the medication. So the persons who studied about medication and the person who is working in the pharmacy is known as pharmacist because they completed their degree or diploma in pharmacy. So they'll study about the drugs and its action. So they'll dispense medication. So they'll dispense the medication from the pharmacy to the patient. Also ensure safe and effective medications you use. So they'll explain to the patient when and where the medication should take, what are the safe and effective medication use, how to use the medication safely and effectively. Also provide drug information to patients and healthcare professionals. So they are the people, they are giving the drug information to the people as well as the healthcare professionals. So they are the people who will dealing with the pharmacy or medicines in the hospital. So this is pharmacist. Coming to next one is allied health workers. So what is allied health workers? They'll facilitate rehabilitation. Also, they'll improve the physical abilities of an individual, providing therapy to manage various health conditions. So they are the people, they'll give the therapies or other management or rehabilitative measures to the patient. So that is allied health workers. Next is lab technician. So in a hospital, there will be particularly a lab will be there. The person who is working in the lab is known as lab technicians. So like diagnostic tests on patient samples like blood, urine. So they will do usually the blood sample collection they will do, and they will do the blood test, they will do the urine test and feces test, sputum test. So everything will be done by a lab technicians, and they are working in the laboratory of a hospital. So that is lab technician. Coming to the radio technologist. So the person who is working in the radiology department, like operating imaging equipment such as X-ray, MRI, CT scan and other type of radiology scans. So that person is known as radio technologist. Next one is nutritionist. Who is a nutritionist? It's developing dietary plan. So that basically the person who will develop a dietary plan for the patient. So that is what called nutritionist, and assess patient's nutritional needs. So they'll assess the patient's need for nutrition, also providing education on healthy eating habits. So they'll give a health education based on the nutrition to the patient and their family. So this is the role of nutritionist in a health team. Next is administrative staff. So a hospital is definitely need administrative staffs to manage the administration, like to manage appointments for the doctors and appointments for the consultation, medical records and billing. So keeping the medical records, also the billing also we need administratives and other administrative tasks. So we need administrative staff. So these are the main members in a health team. Yes, so that's the main members in the health team overall. Now we are going to discuss about nursing health personnel. So what is nursing health personnel? A district public health nurse play a crucial role in promoting and protecting the health of communities within specific geographic district. So who will take care in a district? District public health nurse. So district public health, what are their roles? So emergency preparedness. So if they need to have an emergency preparedness to have or to meet the emergency situation like a disaster or like a season, like monsoon seasons, rainy seasons, very dangerous and risky. So they are the people who will have the emergency preparedness. They need to have the emergency preparedness to meet the disasters. Community assessment. So they have responsible for the community assessment of that particular community. Also health promotion works like vaccines, campaigns, health education should be done through this nursing health personnel, that is district public health nurse. MCH care. So what is MCH care? Maternal and child health care also is coming under the roles and responsibilities of a district public health nurse. Disease prevention, also the policy development. So these are the main role of district public health nurse. So now we are moving to block health nurse. So the other category of nurses that are block health nurse. So what is block health nurse? It's a block health nurse is a nursing personnel who plays significant role in providing health services at community level, particularly in rural or remote area. So basically they are working in the rural or village area. They'll give health services or the services rendered by the government through this block health nurse. They will give to the village and remote area. So that is what called the nurse who is working there, that is known as block health nurse. So it's a block health nurse is a nursing personnel who plays a significant role in providing health services at the community level. So they are basically in the community level, they are giving the services to the public people, and particularly in rural or remote areas. The term block typically refers to administrative subdivision in certain regions or district, but the BHN is responsible for overseeing healthcare activities within specific administrative area. So they are the people who have the responsibility of taking care of a particular people in an administrative area. So that is what called block health nurse. Next category of nurses who is working, that is public health nurse. So what is public health nurse? It's a registered nurse who specializes in public health nursing. So the person who completed the nursing and he or she is a registered nurse who has specialization in public health nursing. So that is what called public health nurse. They work within the communities to promote health, to prevent disease, and to improve overall well-being of the population level. So they are working in the communities to promote the health, preventing the illness, and also to improve the overall well-being of each individual they are living in that particular community. So that is what called public health nurse. Next is lady health visitor. So who is lady health visitor? It's a public health professional who play a crucial role in providing primary healthcare services. She is the person, lady health visitor. She is the person who is responsible for primary healthcare services, health education, maternal and child healthcare within the community. So within the community, she is giving the primary health services, education, and maternal and child healthcare, MCH services. So that person is known as lady health visitors. Next is female health worker. So who is female health worker? A female health worker is a frontline healthcare provider who delivers essential primary healthcare services. So she is the person who is giving the essential primary health services, health education, and outreach programs, particularly in rural and underserved communities. So they will work in the particular rural areas or in the underserved communities, and they are giving the best primary health services, health education, and also the programs, outreach of programs by the government of India. So this is female health work. Yes, so we have discussed unit number 8. Mainly we need to discuss there what is health team, what are the members in health team, and what are the special access to nursing personnel. So what are the special categories of nursing? So we have discussed. Now we will discuss unit number 9, that is health information system. So what is health information system? It is a comprehensive system designed to manage and store health related data efficiently. So it's a system we are managing the health related data efficiently. That is what called health information system. So it encompasses collection, storage, and retrieval and analysis of patient information. So what are the things it contains? It contains the collection, storage, retrieval, and analysis of patient information, as well as transmission of this data between healthcare providers, patient, and other relevant stakeholders. So they will collect, storage, retrieval, and analysis the data, and also they will transmit this data to the patient or the stakeholders or to the healthcare providers. That is what known as vital statistics or health information system. So next we will see sources. So what are the main sources of health information system? Electronic health records. So through electronic health records. Next is health information exchanges. So from the health information exchanges, clinical decision support system, CDSS, telemedicine and telehealth platform. So nowadays it's very common, telehealth and telemedicine. Through the telephone or through the technology, we are connecting to the doctor and we'll get the prescription and we can buy the medicines from anywhere of the world. That is what called telehealth and telemedicine. Population health management, mobile health like mHealth, also patient portal. So these are the sources of health information system. Now we will discuss about another important topic, that is vital statistics. So what is vital statistics? It refers to data collected on vital events within a population. So data of vital events in a population is known as vital statistics, like primarily birth rate, death rate, marriages, divorces, fetal death. So what are the data we are collecting through vital signs? Birth rate, death rate, marriage rate, divorces, and also fetal death. These statistics are essential for understanding the population dynamics. Why we are collecting vital statistics? To understanding the population dynamics, monitoring the public health trend, and informing policy making. So this is vital statistics, nothing but the data collected on vital events such as birth, death, marriages, divorces, and fetal deaths. Why we are collecting this? These statistics are essential for understanding the population dynamics. To understand the population dynamics, to monitor public health trends, and to inform in policy making. So that is vital statistics. So next we are discussing about vital events. So what are the main vital events? Birth, death, marriage, divorce. So that are the main vital events. So we'll see the equations to calculate the vital events. That is, first one is crude death rate, CDR. So how we can classify that, or how we can calculate total number of death in a year by mid-year population. So total number of death in an year by divided by mid-year population into 1000. So then we will get the crude death rate of this country. Also ASMR. So how we can calculate? That is number of death in a specific age group in year by middle year population of the same age group into 1000. IMR. So that is infant mortality rate. Number of deaths of an infant below the 1 year of age by number of live births in the same year into 1000. MMR. Maternal mortality rate. Number of maternal deaths in a year by number of live births in the same year into 1000. So these are the main equations used to calculate the vital statistics. Yes. So that is unit number 9. So mainly we need to study about health information system, vital statistics and the formulas to calculate the vital statistics. Now we are coming to the last chapter, that is unit number 10, health agencies. So what is health agencies? It's a governmental or official body in a country of the territory, as well as any national or international local regulatory agency, department, bureau or other governmental entity which reviews, validates and delivers regulatory approvals. Nothing but the people, health agencies working to the public. It will be government agencies, non-government agencies, international or Indian also agencies. So let's discuss one by one what are the main agencies. First one is WHO, that is World Health Organization, is the first and most important health agencies internationally, and also they are working in India. So the original WHO dates back on April 1945. So it started in April 1945 during the conferences held by San Francisco and the setup of United Nations. WHO is established on 7th April 1947. So that is Health Day also we are celebrating 7th April 1947. So that is WHO. WHO will work for the international as well as Indian. They will work for all the public like disease control and health promotion. So disease prevention and health promotion is the main aims of WHO. So United Nations Fund Population. So UNFPA is an international government development agency created in 1968, has been providing India assistance to 1974. From 1974 they are giving assistance to India to disease prevention, health promotion measures. Next one is United Nations Development Program. So what is United Nations Development Program? It is UNDP is established in the year of 1966. So UNDP has worked in India from 1951, almost all areas of human development. So they will work in the human development from systems and institutional strengthening to inclusive growth and sustainable livelihood, as well as sustainable energy and environment and resilience. So they will give the sustainable development. So they'll focus on the development of that country. So they'll assess or they'll help for the sustainable development. Next is the World Bank. The World Bank is established in the year 1944, headquarters in Washington and DC. So they will give the loans or the amount that is necessary for the countries for their sustainable development, disease prevention and also for the health promotion. So they are the people, they'll give, the World Bank is giving the loans and the benefits like economic benefits for the countries. Next is Food and Agriculture Organization, FAO. FAO was founded in 1945 with headquarters in Rome. It is the lead United Nations agency for agriculture, fisheries, forestry and rural development. So what are the main things FAO is concentrating on? The agriculture, fisheries, forestry and also rural development. So this is FAO, Food and Agriculture Organization. Next one is United Nations Educational, Scientific and Cultural Organization, UNESCO. So what is UNESCO? United Nations Educational, Scientific and Cultural Organization. So it is specialized agency for United Nations aimed in promoting. So why it is? It is promoting the world peace and security through international cooperation in education, science, culture and communication. So they are promoting the peace, promoting the world peace and security through the cooperation in education, science, culture and communication. That is UNESCO, stands for United Nations Educational, Scientific and Cultural Organization. Next agency is International Labour Organization. So through this we can able to identify that ILO is mainly for labor. So it's protecting the labor from harmful working hours, harmful working environment, and for the benefit of labor. So that is International Labour Organization. It's established in the year of 1919 and affiliate to League of Nations to improve the living conditions of working population all over the world. So they are mainly for the improvement of living conditions of all workers who are in the working environment. So for that they have established this International Labour Organization. Next is Indian Red Cross Society. So what is Red Cross Society? Jean Henry Donat to alleviate human suffering established Red Cross Society in 1920 for promoting health, preventing disease and mitigation of suffering. So they will help the emergency situations, management of disasters, disease prevention in India. So they have different branches. They also have blood banks for the people who needed blood during the surgery or during the hospitalization. So they have blood bank activities, milk and milk products is there, military services, they will give the services to the military also, and emergency disaster management and disease prevention and health promotion. So that is Indian Red Cross Society's functions. Next is Hindu Kush Nivaran Sangh. It is founded in 1950, Indian Council of British Empire Leprosy Relief or Association, renamed after lepra in 1950, was considered precursor of this Sangh. So nothing but to control the cases of leprosy, to treat the cases of leprosy, this Hindu Kush Nivaran Sangh is founded in 1950. So the control and treatment of the cases and the prevention of new cases and the early diagnosis and treatment. So that is Hindu Kush Nivaran Sangh. Next one is Central Social Welfare Board. So it was established in the year 1953 by Government of India. So it is autonomous body, functions under the Ministry of Education. Central Social Welfare Board. Yes. So we have discussed about 3 chapters, that is unit number 8, unit number 9 and unit number 10. So I hope everyone understood. So for further explanations and videos, please subscribe to EasyNurse or please download EasyNurse from Play Store or App Store. So till now we had discussed about all the chapters of community health nursing. I hope everyone understood. So continue learning with EasyNurse, where nursing education made easy. We will meet in the next sections with another interesting topics and another interesting